forth, and ye shall be heard. God bless this nation, state of Tennessee. God bless Putnam County and its honorable commission. Mr. Chair, I find these premises being open.
Thank you, Major. Appreciate you being here for everything you do, always. At this time, we'll do the invocation and pledge led by District 4, please. Brother Wayne, thank you.
Thank you. He's asked me to do the invocation tonight. Would you bow with me, please? Father God, we sure do thank you for your love and your blessings. You are an awesome God, and we are so blessed. Father, thank you for the opportunity to serve in this great county, and I pray, Lord, your blessings over every one of these guys who are serving in any capacity tonight, and especially this commission. I ask you, Lord, to empower them with wisdom from on high. And Lord, that whatever comes before them, whether it be tonight, the next time, or whenever, all through their time of serving, may you just be there to give them wisdom in everything that they say and do. Lord, we thank you. This is a neat season where we stop. Help us, Lord, not to get so busy with busy that we don't pause to understand the reason for this season is that you came and gave, you're born, and you're born to die, and that we could have life and have it more abundantly. We thank you for it. Father, we give you honor and thanks and praise. And for those tonight who are, wherever they are, that are serving abroad in our armed forces, that are in any possibility of harm's way, I ask, Father, for a Psalms 91 protection. We give you thanks in Jesus' mighty name. Amen.
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Ready for roll call?
Mr. Clerk, you please call the roll.
All right, ladies and gentlemen, if you will take your handsets, everybody press yes and just stop right there for me, please. Pressing yes and stop right there. All right, now everybody press confirm for me, ladies and gentlemen. Everybody press confirm, please. Mr. Chairman, you have all 24 present tonight. There is a quorum.
Thank you, Mr. Clerk. Item number 5, approval of the agenda.
Motion to approve.
Second.
I have a motion and a second. Any discussion on the agenda? Commissioner Adams?
Yes, I'd like to make a motion that we amend the agenda and move item C under the Fiscal Review Committee up to A so that we can discuss the terms of the contract before we take a vote on the budget amendment.
Okay. So we will be moving item C under section or part 2, Fiscal Review Committee, before A. So effectively, item C would become A, and then and item A would be B, and then item B would be C.
Second that.
We have a motion and a second to amend. Any discussion on that? All in favor say aye.
Aye.
Any opposed? Motion carries. Amendment carries. Now we need to go back to the original motion as amended.
Motion to approve. Second.
Motion second. Any discussion? All in favor say aye.
Aye.
Any opposed? The motion passes. Everybody understand what we just did? Okay. Thank you. Item number 6, approval of the minutes of previous meeting.
So moved.
Second.
Have a motion second. Any discussion on the minutes? All in favor say aye.
Aye.
Any opposed? The minutes are approved. Item number 7, unfinished business and action thereon by the board. A, report of standing committees. Number 1, planning committee.
No unfinished business.
Number 2, fiscal review committee.
And no unfinished business.
Number 3, nominating committee.
No unfinished business.
Thank you all. Item number B, report of special committees. Item C, other unfinished business for the commission. All right. Moving on to item number 8, new business and action thereon by the board. Item A, report of standing committees. We will start with planning committee.
Thank you. The planning committee recommends approval of the sheriff's office request to declare the following items as surplus and to sell the VIA internet auction. We have 12 items listed, and I so move.
Second.
Have a motion, second. Any discussion? All in favor say aye.
Aye.
Any opposed? That motion passes.
Thank you. B, recommends approval to sell surplus fueling equipment at the maintenance department as following. And we have 3 items listed, and I so move.
Second.
Have a motion, second. Any discussion? All in favor say aye.
Aye.
Any opposed? That motion passes.
Thank you. That completes planning.
Thank you, Madam Chairman. Number 2, fiscal review committee.
All right, as amended the agenda, we'll start with, item C, which becomes item A. And, fiscal review recommends approval of request by the Sheriff's Department to award the recent bid contract for healthcare services at the jail.
Motion to approve.
Second.
Have a motion, a second. Any discussion? Sheriff, you wanna come up at this time?
Sure.
Thank you, sir.
First of all, thank most of you who have been over to my office, either in many times or come to take jail tours or have called me on the phone regarding this issue. I think, your knowledge and some of the things that you see over there hopefully will help you tonight make some decisions. This is the first time that I've had to come back in 4.5 years and ask for jail funding. I don't like being up here asking for jail funding. However, it's hard to predict what our jail cost is from year to year. Inmate population drives that. Health of the inmates drive that. Unforeseen sickness and surgeries. Billing drives that. Healthcare companies are allowed to wait almost or right at a year before they bill us for whatever services is rendered. Sometimes that gets skewed, and sometimes that takes a long time for that bill to come in to actually project what costs are. So that is one of the reasons our budget has increased, along with our outside medical visits and expenses, as well as the new contract we're asking for, which includes more staffing and more equipment. And that's something we feel like we need desperately in this contract. TCA code 41-4-115, medical care of prisoners. State and federal law requires inmate medical care, all of which is unfunded. So that puts a burden back on us, the county, to do that. 25% of Putnam County is indigent. 65% of the 25% is incarcerated in our jail. Commissioner Williams, you asked last meeting, and I did not have those figures with me, but you asked about, do we charge for inmate billing? The answer to that is yes, as the same was last week, but I didn't have those figures. So since January of 15 through December of 18 of this year, January of 2015 to December of 2018, we've collected just under $65,000 from the inmates. However, we have another approximately 41,000 that's outstanding that they could not pay. That is $10 per visit for a doctor's visit and $5 prescription that we charge. That money comes out through the system, through our commissary system is where we take that money from. Commissioner Wanazon, you asked the other day about some figures from other jails. Washington County is at 1.6 million. Sevier County is at 2.2 million. Sumner County is at 1.4 million. Coffee County is at 1.3 million. Robertson County is at 1.2 million. Montgomery County is at 3 million. Haywood County is a 132-bed facility, and it's at $650,000. So that's just some of the comparisons and some of the figures that we could obtain for that. Even with this new contract, our medical cost is somewhere around $8, and we feel that's good. The national average is somewhere between $11 and $17. And so we're able to feed for 88 cents a meal. So you add 3 meals a day plus our medical costs, we're still in good shape. But once again, let me add, if I knew you were gonna give me an extra $600,000, it would be to go out to prevent crime and fight crime, not put it in our jail facility. However, that's one of the 4 TCA codes that the sheriff is responsible for, as you, to take care of the inmates and house them. So that's what we're doing. Tonight, with me, I have Jim Hart of CTASC, it's County Technical Assistance from the state of Tennessee. He is a jail expert. He's run many jails. He also works for the state of Tennessee and helps other counties in this matter. He's here. I urge you to ask him any questions and a lot of questions that you need and want to. He is very helpful. Also, Dr. Bates is with Quality Medical, and some of his staff is here tonight, so they are here to answer anything regarding jail medical and the contract. So with that, I'll open it up for questions or comments or wherever y'all like to start.
Commissioner Adams.
Yes, I guess the first thing I want to say is, I think we would all agree that the health care of prisoners in our jail needs to be cared for, and we appreciate very much that you take it seriously and that you make sure that their necessary health care is taken care of. So that is not a question. We do appreciate that you take it seriously. I guess my first question is, when does this contract have to be signed?
We signed a 60-day contract, which is good till January the 21st.
So we have till January 21st. So technically we could...
But I would urge you to look seriously to doing something tonight. And if you got questions about that, please direct them toward Dr. Bates. But he will be glad to answer the reasons for some of those. I think they have already upgraded and spent quite a bit of money with us, trying to help us in certain areas that he can speak on.
I appreciate that. It is a little disconcerting to us, I guess, that we had a week and a half to consider this when it's such a huge amount of money.
Sure.
It would have been nice to have a heads up a month or two ago.
Well, let me reiterate earlier, when last week I tried to say this, I'm not sure that it was understood, but we put the RFP out. The contract ended October the 31st. The county exec takes care of the RFP. It went out October the 2nd. So there's only two companies out of many that we put it out to, including in the paper, which other folks could have bid on it. So, and once again, there were some things that happened toward the end of the contract that made us huddle up, as you might say, and decide that we needed to put it out for bid. So that and some of the other driving costs, so that's why we've done that.
Sure. Again, if maybe October 31st we'd have gotten an email saying, hey, it looks like this is going to be high, it would have been nice to know.
Sure. Sure, go ahead.
Let me address that too, because it was a shock for us too, and I know it was for you. Some of you may recall, we had this contract at one time with Sheriff Andrews when he was here, and I got 1 day notice to start. He called me the night before and said, I need you to start tomorrow. And so we had a week's notice this time, so we're getting better at being notified sooner. So, and I know that it's a sticker shock compared to where you were, but you are low, artificially low to the expenditures that need to be made and the processes that need to go on in the jail. I know all of you know that the inmates are the only ones required to have health care. None of us as citizens is that true for, but for inmates, it's in the Constitution that they are mandated health care. There's a confluence of things that are going on right now that have driven cost up, And one of them is that when we were here before, you only had 250 inmates in the jail. And I know you had inmates scattered in other facilities, but at the jail itself, there were only 250. This is one of the busiest jails in Tennessee, bar none. We have several jails. We almost have almost 30 jails in Tennessee. It's probably, and when we had this years ago, 4 or 5 years ago, I'm not exactly sure now how long it's been, I said then this was one of the busiest jails in Tennessee. It's as busy as jails that are larger than Putnam County. I saw the first case of bath salts here. And so the level of illness that we're seeing in inmates is also increasing, as is the med-mal environment and lawsuits. The plaintiffs' attorneys are going after counties and facilities all across Tennessee, actually all across the Southeast. When you look at the contract and you look at your expenditures in the jail, and I want to talk specifically about the contract, the major cost that you have is labor, and then the second highest cost is pharmacy. So our pharmacy cost will save the county. Go out to your local pharmacy, even to the hospital here, you probably could not compete with the pharmacy prices that we get. For instance, they looked at this at Hinds County, Mississippi. We have the contract in Jackson, Mississippi, which is a fairly large city. They have 1,000 inmates. They thought they could do better on the pharmacy cost. So they had a consultant come in and look at it. On average, now this is not true for any one particular drug, but on average our costs were 15% below Medicaid in Mississippi. So you'll save money with pharmacy by utilizing us. The other thing that you get with us is our experience. I serve as an expert witness. I probably have 6 expert cases going on right now, so you get the benefit, or I get the benefit of knowing what's going on out there in terms of lawsuits. The potential risk, the fact that they don't receive a lot of training, and you're bringing somebody in from the outside to work who hasn't been properly trained. So it behooves us to keep the jail staffed and to keep it with staff who take corrections seriously and want to be involved in corrections. In saying that, that raises the labor cost. In Tennessee, as across the nation, there is a nursing shortage right now, and I understand one of you is a nurse, I believe it's you. There's a tremendous nursing shortage. It's probably the worst I've seen it, and I've been practicing medicine for 35 years. Matter of fact, I've gotten so old I don't buy green bananas anymore. But the problem is that you have a small pool of nurses to begin with, and everybody's competing for them. So to get a nurse to work in corrections, you can't just pay the prevailing wage in that area, because you have to entice them and attract them to come to work in corrections. So that's going to automatically increase your labor cost. And you want the best nurses you can get. This is the hardest job as a physician I've ever done. I've worked in the emergency room. I've been an intensivist. I'm an internist by training. I have a master's degree in medical management. But as a physician, this is the hardest job I've ever done, and it's the hardest job for a nurse. You deal with a clientele that you have to sort out the wheat from the chaff, and it really, an ER nurse makes probably the best correctional nurse because they're used to triaging, and that's a lot of what we do, is try to decide who's sick and who's not. The other thing that you have to keep in mind is we have to pass TCI. We've never failed a TCI inspection as a medical group in Tennessee. To the national standards, and I read an article that was published, come from here, I'm not sure who the source was, about doing it yourselves. The problem you get into when you do that is you lose all that experience. For instance, we have a CQI nurse who does quality assurance. We have a training nurse. We have 3 or 4 levels of nursing above the nurse that's going to run the jail. You can't buy that kind of experience, and you can't bring that on yourselves. And that's one reason why no one does this much anymore by themselves. It's too difficult. It's too expensive. Also, you need physicians and nurses who are trained in corrections, because it's not the same as taking care of somebody out in the clinic. Their problems are different. Most of these people have not received any health care. We have the problem of substance abuse, opiates, methamphetamines, and so we get a much sicker population. That's the reason why you're seeing your off-site costs go up. Also, we have been inundated with mental health care. The jails have become the dumping grounds for mental health. It's difficult to take care of these patients, and someone mentioned Coffee County, Tennessee a while ago, and I'll just use it for an example, because we've had that jail for a number of years, and the costs have gradually escalated there to $1.3 million, I think. We added a mental health person there part-time for 20 hours a week. It was so successful that within 3 or 4 weeks, they wanted the person full-time, because it reduced the number of fights in the jail. It gave the inmates someone else to vent to, and it relieved the officers of having to deal with patients with mental health, and it got them triaged to our high level of care much more quickly. We propose doing the same thing here. In addition, we have actually hired someone who will be starting in the next few weeks. The cost plus contract, in my mind, is the fairest, simplest way to go. You know exactly how much I'm going to make. You know roughly what your expenditures are going to be. My fee's capped. In a fee-for-service contract like you normally have and like we did in the past, you have no idea what I'm making. You have no idea what your costs are. You will see every invoice that comes through that jail. So I know I'm long-winded and I could go on forever, but I'll be happy to entertain any other questions.
This would probably be a good time for you to clarify exactly how it is we're paying. We have the $97,500 per month. What exactly does that cover, and what exactly does it not cover?
It covers everything, except for your off-site cost.
Okay, so that's what's covering salaries,
Absolutely.
insurance. Okay.
And the way that works is what we do is we take what we estimate the cost to be for the year, okay? And we divide that by 12. And then every quarter, we will give you an assessment of that and where we are in terms of the contract. To give you an example, we have Harrison County, Mississippi, right, that has 1,000 inmates. Their contract's a little over $3 million. And the first quarter, we were $10,000 higher than we said, because the most expensive part of this contract is in the first quarter, because you've got to train, you may have to bring people in to cover, and I failed to mention Tom Patrick's with me. He's one of our startup people and is excellent at that. So he's been here for 3 weeks already? So we have the cost of doing those startup and training. All that generally occurs in the first quarter. So the second quarter at Harris County, we were $130,000 under. So the benefit of this cost plus contract is when we put these proposals together, I have no idea what your pharmacy costs are going to be, what the labor costs are going to be. And so I would have to pad that to make sure that we didn't go broke. This way, it's fair to both of us, because you know what I'm making and you see what you're spending. We also, for instance, the person that I was talking about earlier, as soon as we made them an offer, which was substantially more than they were making, their employer offered them the same thing. So if we had a fixed budget, we couldn't offer them the $1,000 or $2,000 more it took to get them to come. And let me tell you, finding people in mental health, we've only had one application. And we've been running this ad for several weeks. It's very, very difficult, but it will make a tremendous difference in the jail. So all the expenses you'll see every quarter will ante up and then move forward to the next quarter. But we have to have a way of getting paid in the meantime because we're paying all the expenses. So I think it's the fairest way to do it. Do you understand? Does that make sense?
Absolutely. Thank you.
You good, Commissioner Adams? Okay, Commissioner Jordan Awanazon.
Thank you, Mr. Chair. Sheriff, probably just a couple of questions, or about 3 questions real quick. First of all, is this under maintenance of effort? Does this contract, I guess, would fall under maintenance of effort, would be the best way to ask it? The amount that we're discussing tonight, if that's next year, if that comes back up again, and suppose you don't use all that, we'll be mandated to consider this under maintenance of effort.
Well, I mean, we can discuss it each time if you'd like. And I'm sure, I think the increase is 3% a year, if I'm not mistaken.
On the amount that we get.
I'm just kind of curious, 'cause I know like your salaries and benefits is definitely a big maintenance of effort cost. I didn't know if this contract was one that'd be similar to that.
I don't know if it's per se a maintenance effort cost, but obviously we have to produce jail inmate medical, so at some point every year we have to have a contract in place. So whether we decide to keep going with this company or do something else, but.
On that, the other 2 questions had to do with the other company too. I guess Southern's the current vendor, and how much did they bid this year? Because I guess they were the other second bidder that we heard about.
Yeah, I'm gonna bring my chief of administration up here. He's the one that worked with Jeff Jones and the county exec on working the difference between the two there.
Yeah, how you doing? When we broke it all down, trying to compare a grape and a watermelon to some extent. What we had was 2 bids. One was a cost plus, one was a cost pool. Cost pool is anticipating, hey, here's a pocket of money in case you have to delve into it. So taking that into mind, taking into consideration everything, where Quality's contract or proposal came in and said, here's one price, everything you want is in it. The other one was a cost pool, so we have to weigh that option. But at the same time, when you add up, everything was broken down independently. So it may have come off as, hey, here's a price, but by the time you add everything in there to compare apples to apples, the difference was just under $80,000 difference, where Quality was $80,000 more. The unknown comes with the insurance. We required a $3 million, $5 million liability protection towards the county for professional liability. Quality came in at 3.5. The other company failed to match that. They came in at 1.5, but the document they submitted said 1.2. So we inquired, what would it be? And they said, well, we don't know, $20,000 to $30,000 more, but you pay for it. Well, the proposal, we don't play on what we're going with. So bottom line is relatively close to each other in the big scheme of things, but the other one was $80,000, but we don't know.
Sense. My third question would be, why were we not presented with the detailed bids maybe a little bit earlier in the process? I'm under the understanding in some counties you actually have to bring the bids before the county commission before it's decided on. Do you hear all the information beforehand? But I guess first time we're hearing any information about Southern was this question I'm just presenting now, so I was just kind of curious of why we didn't hear about.
So you're asking about the bids?
Yeah, why we didn't hear details on the numbers before tonight.
I'm not sure. They came through the county exec's office who got them. I'm not sure why you didn't get them, but at the same time, we were still trying to ponder on which was going to be the best company at the end of the day.
They were due on November 7th at 2 p.m. I think it was 2 p.m. or 3 p.m. was the opening. We had to have a chance to go through it. Obviously, like I said, they weren't the same. So we're trying to compare what did we have, what are we getting, what's the proposal matching up to. Both of them presented 2 options, so we had to make sure they were like-minded options, and then compare those. Took a little bit to go through, but that was November 7th. But like as the sheriff said, the RFP went out on October 2nd. So it was out there. It was out in the public purview for well in advance.
Thank you.
Can I help answer part of that question?
Yes.
When it comes to bids, if it's in the budget, the bids don't come to the county commission if it's already been budgeted. The only reason that this one came is because only 2 companies bid, and we sent it out to a bunch of them.
I've got them, they're
7
like
different ones.
10,
And,
7 or 8 or 9 or something companies, plus the paper.
So there was no way to know that this one was gonna be this much over what the budget was until after they'd already gotten in. And by the time we got them in and got them compared, the November County Commission had already happened, and so we had no choice but to wait until the December County Commission.
Makes sense, thank you.
Commissioner Wazon, I can answer your question on the maintenance of effort for the sheriff's office. So the sheriff's office has maintenance of effort, and it only applies to his personnel, the salaries and cost of his personnel. There's other maintenance of effort in the state law to other departments, but for just his office, it applies to his personnel. So the medical is not part of maintenance of effort.
Makes sense.
Okay, Commissioner Martin.
Start off, Dr. Bates, got a question.
Yes, sir.
For you.
Yes, sir.
You've been in the business how long?
How long have we been doing corrections, or how long have I been practicing medicine?
Yeah, I know you practiced, you said several years, but in the corrections.
We've been in corrections 14 years.
14 years. So you've experienced a lot of turnover
I have,
because of the shortage and other.
yes, and it's more difficult now than it's ever been.
What would you estimate your turnover to be currently, or the last year, within the last year?
It depends on the area, because we have some sites where there's virtually no turnover, and then we have some sites, where there's a lot of turnover. For instance, Madison County, Tennessee is probably one of the hardest areas we have to staff, and believe it or not, Sevier County, Tennessee, you would think Sevier County would be an easy place to staff because of the mountains and everything, but it's actually very difficult. In those facilities, it might be 10, 15% or more.
Roughly 15%. Currently, what do you estimate it to be here? What would you think it would be?
I don't have a clue. I don't know. I don't know what it's been historically here. It was not that much when we were here before. But one of the things I wanted to, if you'll let me point out about the contract, the difference in what you have now and what you will have, is that presently, you don't have any RNs in the jail at all. And I have been in federal court up against the DOJ and so forth, in a couple of places, one in Kentucky. And the Department of Justice's stance is that we've got to follow the nursing board guidelines in terms of who can do a physical assessment on an inmate. And only an RN can do that. And they have to be trained to do that. So, in my mind, that is a big deal. And, you know, one reason why is because I have to protect us, and I have to protect our med-mal carrier, because one of the things I didn't mention is I met with them about 2 or 3 weeks ago now, and our insurance is with Lloyd's of London. We have a broker in New York. He flew down here to talk to me, and we have excellent rates. I'll tell you that up front. The problem is that there's only about 3 carriers. So, you know, if we are not careful, we're going to end up where there's no one that will insure this industry. And that comes back to doing it yourself, because your liability exposure is tremendous.
If we decided to review whether we want to do this on our own, I try to look at all the downside, and one of them is turnover, because that's the very day you need someone the most. That's just the way life is sometimes. So that's the reason I'm concerned about the turnover.
You're much less
It's
likely
It's
to have turnover with us for this reason, is that we're constantly in a mode of recruiting. So we have people who do nothing but recruit. So unless somebody just walks out of the jail and doesn't give us notice, then we're going to be recruiting heavily to try to get people in here. Another thing about the cost plus contract you have to understand is that we've been here almost a month now. It's taken us that long to hire the first 2 RNs. You haven't been paying for those RNs. You only start paying for those RNs when they come on board. If you had a straight fee-for-service contract like we would normally do, you've been paying for those RNs from day one.
Now, the contract, it expires on the 21st, and we have a 60-day clause, am I correct? The new contract, is it also 60 days?
No, the new contract is for a year.
1 year?
What?
I'm talking about termination.
The contracts, yeah, there's a 30, 60, 90 day out clause in all the contracts, so yeah, it's a,
What's the penalty?
to tell you the truth, that's never happened, so I don't know if we've ever penalized anybody.
I believe that's all. Thank you.
Thank you.
Commissioner Donadio.
Thank you. Dr. Bates, thank
Yes,
you for
sir.
coming in. First, let me thank you, and Sheriff Eddie Ferris, let me thank you as well for, on very short notice, allowing me to take a look at the jail medical. Got a little bit of experience. I worked in the prison down in Guantanamo Bay, which is much different than working in a jail. I found that out very quickly upon visiting, so thank you very much. I appreciate the
Thank you.
time. Looking at the contract, one of the big uncontrollables that we have are the off-site costs, and you mentioned those. We can't do anything about an inmate falling down, cracking their head. There's nothing we can do about that.
Okay, go ahead.
But what we can do, and you'll have an RN on staff for this, is the assessments to try and figure out whether or not any given inmate truly does need to go out of the building or can be treated in-house.
Yes. I got a call about that very thing from Washington County on the way up here this afternoon. I wasn't even the doctor on call, but they called me. There's 2 or 3 levels involved in that. The RN can call the nurse practitioner who's on call, who then, if the patient who feels that the patient needs to go out, still has to be approved by a physician. So the next call would be to the physician. And I've stopped some people from going out, and then I've said, get them out of there as quickly as you can, too. So you have a couple of levels of involvement there, all the way up to a physician. It actually requires a physician, unless it's a true emergency.
Sure.
To go, before they go off-site.
Okay, so what I'm going to be asking for, and you probably don't have this number on you right now, but if you can get it to me, it would be wonderful. Have you seen or have you been able to track a reduction in jail facilities after they hire your group as opposed to prior to your presence?
Yes, and I actually printed that out. I would like to show you this in private because first of all, it's not my data, it's from an insurance company.
Okay.
But for instance, I mentioned Hinds County. When we took over Hinds County in 2015, at the end of 2015, the expenditures for off-site medical care were $9.8 million. Yeah. But there's a good thing about that in a second, I'm going to tell you. And then in 2016, after we've been there a year, it was down to $2.8 million. But in Mississippi, and this is something I've tried to get people in Tennessee to be interested in, they have a law that if an inmate goes off-site for medical care, the most the county has to pay is Medicaid. That would save the people in Tennessee a ton of money. And I've talked to Commissioner Bradley about this, to Sevier, because if you were to get that law passed in Tennessee, now the Hospital Association is going to fight you tooth and nail, but if you got it to where you were paying TennCare rates when an inmate went off-site, it would save the county a ton of money.
That's interesting. All right. One more thing, and just to reiterate one thing that you said. I was thinking about the Tennessee Nurse Practice Act, and one of the LPNs who was on staff was telling me that with the prior contract, the LPNs were doing the assessment, and that kind of took me back a little bit because that's how they're scope of practice.
Right.
That's not going to be happening with your...
That's not going to be happening. And
Okay.
the other thing is, We call them health service administrators because that's generally what the community calls the person who's in charge of the medical at the jail. In your case, they were called MTAs. And the reason for that is because you can't have an LPN supervising other LPNs. So that's a violation of the Nurse Practice Act as well.
It is.
So we will have RNs supervising LPNs.
I appreciate your answers. Thank you very much.
Thank you.
Commissioner Joe Wanison?
Thank you. Malcolm, thank you again for being here. Just a couple quick questions.
Sure.
Appendix A, I see you have about approximately 11.6 FTEs, and I see a schedule matrix. Is there any possibility any of that could be rearranged in a manner, and I'll get specifically, especially for the mental health. You have it Monday through Friday. Sheriff, he knows that typically the weekends could be the bombardment of situations. Can any of them be rearranged to schedule maybe Tuesday through Saturday or Sunday through Thursday, or?
If we can find the people to do it. I mean, that's usually the problem is, like I said, the person that we hired who gave us the yes on Friday, this morning called and declined the offer because where they were at had offered them the same amount of money or more. So the problem you're dealing with, especially in mental health, is that there's so few practitioners out there that it's hard to get that. It's very difficult to get that kind of coverage. But we're open to anything. We're going to try to find the best solutions, and that's the other beauty of the cost plus contract, is that unlike a fixed contract, if I talk to the sheriff and he agrees and we come before you or whatever, we can amend that fairly easily. We say, we need a person to do this, and that's going to save X because we're doing it this way. Because the next thing that's going to hit is going to be the opioid epidemic and treating opiate addicts in the jail. Matter of fact, there was a federal judge that drew us a rule that you have to give methadone in jail. Now, that opens up a whole can of worms.
So to, go on, with that conversation. So if the sheriff has a need on the weekend, will that individual, or will there be an individual available, and what would that cost be? Potentially, I'm asking.
Well, it would be whatever it cost us to provide it. I mean, and so, our costs essentially are fixed. It's the 152 or whatever it was in the contract. If you want services above and beyond that, then you're just paying for the cost of the service.
Okay. And those costs will be provided, up front, so we know what those costs will be?
Yes.
Okay. And also, in Appendix B, I have a question. Under the new contract, and I know you sort of mentioned this, but what would be the potential budgeted numbers for that? Because if you see there, everything is labor costs to include, pharmacy medication to include, medical supplies to include, and it really would be good to know a potential number.
And you said it's an Appendix D?
Appendix B.
B?
Direct cost to OCHC to be reimbursed by the county under Section 3.1 of this agreement.
Okay, I just found it. Repeat your question for me if you don't mind.
Okay. Again, potentially, these costs will be added as plus. Is there any typical budgeted number we could be provided with that we could look for future budgets so that we just don't get caught like this, just getting a,
Absolutely, because you're going to know what the costs are. Every quarter, you're going to know what you spent. I mean, we're going to provide you with every invoice that we paid that went to the jail. So you're going to know exactly how much we spent on pharmacy, how much we spent on labor, how much we spent on the mental health providers. You're going to have all those costs. And you can see how that compares to the budget. And then next year, you're going to know what the budget amount's going to be.
So, again, it would really...
What we're going to be able to do is, with the cost plus, take this as a track record, extrapolate it out for anticipation of next year's fiscal. The problem we had with the past contract was we didn't get those itemized bills for anything under $5,000. The the vast majority of what you're asking for is the under $5,000, the $2,000, the $3,000, the $4,000 charges. We can't put a number on it. We tried checking with other counties. Most of them had no clue where to even begin with that. To put a price tag on an x-ray, they said it just depends what you negotiate at. Sometimes some are going out straight out negotiating. You got some counties in other parts of the state, the hospital just gives them to everything for free. There's no cost, okay, because the county owns the hospital. So it's a wash. Sometimes that works, sometimes it doesn't. We tried to put a number to it, but we cannot do it at this time. So with the cost plus, we'll at least have, let's call it 6 months worth of data, 4 months worth of data. We'll be able to extrapolate that out in a multiplier and try to come up.
Potentially, we could come to next quarter, and what if it's tremendously high?
Actually, the first quarter is gonna be high. I mean, it always is, because, the training and stuff that's involved. The second quarter is a better indicator of where you're gonna end up. Because also, remember, we're coming in, all the meds are gone, so we're having to order stock meds. So all the things, we're having to resupply the jail, basically, with all the supplies, gauze, syringes. So all that hits in the first quarter. So the first quarter is gonna be higher than it is. And as I told you, like in Harrison, we were like $10,000 higher than what we budgeted, what we said we would be. And then the next quarter, we were $130,000 less. So it fluctuates. But the first quarter, I can guarantee you, was gonna be higher than.
One plus that'll help us with that, besides the billing from this company, would be the electronic medical records, which we don't have now. 36 banker boxes went to the basement when we switched companies. We're gonna have electronic medical records. We'll be able to tie their bills to their procedures to an individual to see if there was an anomaly where somebody fell and knocked their head, that'd be life-flighted, whatever. We could take that out of the equation and try to get a true cost per, what it would be for an inmate.
So, one more question.
Sure.
I know you submitted for a 1 year. Any reason why you didn't propose maybe a 3 or a 5 year contract?
I think that, it only asks for a year. Was my understanding. I mean, that was that.
You're correct. Most of our contracts we'll do a renewal on, but those are smaller in nature. When we start talking this kind of money, this type of unknown, to do it as a 1 year, turnover, if we have to come back, then we could present it. We could also get other parties involved in this, just like we have with all these other folks that we've brought with us.
In typical business, if you go 3, 5 year, you can get savings because you're in a concrete situation. I don't know if your company offers that.
We do, but in a cost plus contract, that's not as big a deal because, for instance, maybe an EKG machine where you're gonna amortize that over 3 years, but the electronic medical record will be your electronic medical record whether we're here or not, because the records always belong to the county. So in a cost plus contract, it's really not that significant. But the one thing I want to stress too is why don't do cost pool contracts. As an expert witness, I've been put on the stand more than once and asked about the cost pool, both when we were doing them and in other situations. That is a litigious nightmare because the first thing they're going to say is, Dr. Bates, you didn't order little Johnny's MRI scan because you were trying to save money in that cost pool. You can walk into federal court and say, we spent what we had to spend. We did what was appropriate. It wasn't based on any financial remuneration to me or to the county.
Yeah, and just go along the lines of 3 to 5 year. There's no way to put a projection on it, especially with medical. As you know, the county knows, you don't get 3 to 5 years from Blue Cross Blue Shield. You don't buy it today and say, well, we're gonna keep you for 5 years at that rate with a 3%. I don't think they would ever do that. So we're in the same boat when it comes to anything medical. We don't know what the costs are. Pharmacy may boost the price tomorrow. There's no way to put a number on it, and I don't think that we could accept it, either in good faith or otherwise, to try to make that fit.
And I think the other thing too, by doing it this way, it gives you the ability as you grow, and I think from what I hear that's a possibility that you may grow in terms of the number of inmates. For one thing, I would suggest, as your population grows, especially if you get another 100 or 200 inmates, is that you put a full-time nurse practitioner in the jail. That would save a tremendous amount of money, people going off-site for stitches and things like that. I mean, you can't get out of the emergency room for $5,000 if you go in just for stitches. So having someone there, and we've done this in several places, as a matter of fact, we did it in Harrison. It really makes a big difference. They used to tell me that they had 2 ambulances backed up to the door all the time there. I couldn't tell you the last. This makes a tremendous difference. Those kind of things that you can do will improve the service and decrease the cost going forward.
Thank you. Thank you,
Thank
Tim.
you.
Appreciate it.
Commissioner Wilson.
Dr. Bates, thank you for being here.
Yes, sir.
I got a question on 1.18, talks about the off-site and specialty services. On the second line, it says QCHC will arrange for inpatient and outpatient hospital services and mobile services. Is that discussing transportation?
No. It discusses us having an arrangement with the emergency room to send patients off-site. And also for mobile services like mobile x-ray and so forth. And also we send lab work off to a national lab.
And then on section 1.18.2 with the claims management, right, currently it is, who's currently handling the claims now? Well, as far as, they're talking about taking over the claims.
Meaning us.
I'm talking about QCHC on one.
They'll handle everything outside of the Cookeville Regional CRMC spectrum for, radiology, anesthesiology, pathology, and emergency room. That's gonna be billed directly to us.
Okay, do we see this being any of a manpower cost savings for us, something we're not gonna have to do and that they're taking care of in this contract?
No, they're both companies took care of all the paperwork prior.
Okay.
It's whether, I'd rather have the detailed bills to answer questions like being
Agreed.
asked versus
I agree
being
with that.
stuffed in an envelope saying, here's last month's.
Okay, thank you.
Okay, let's see, Commissioner Christopher.
Sheriff, thank you. Just a quick question. I was under the impression last week that we did not collect copay. So what you're saying tonight is we do collect
No, I didn't answer the question really last week because I didn't have the numbers.
Okay.
Yeah, I knew that we collected, I wasn't sure how much we had collected.
Okay, so we do collect out of the commissary fund.
We do.
Do you have any idea, I think you said that we had collected 60 but left 40 on the table, basically, was that correct?
Yeah, 60, or just a little bit shy of 65 we've collected, and a little bit shy of 41 that we've not collected.
Do you know what the obstacles to collecting on the remainder were? I mean, I know it's not a lot of money, but every little bit is...
Well, I mean, we keep that on record. They don't have money in the commissary, so if they come back at some point and put money, or somebody puts money on the commissary, then it'll show up and we'll take it.
Okay, so it's only collected against money that's sitting there.
Correct.
In the fund.
Correct.
So if property is seized in connection with an arrest, nothing like that is available.
Well, most of the time we're seizing property, then money's not an issue, for medical. But most of them are indigent; they don't have anything. In fact, if they can't buy Cokes or potato chips, they're not gonna have any money for medical. So.
Okay, and so Jeff, under the code that allows counties to collect copay, is that the only mechanism? Is that they could only collect if there's money sitting in a commissary fund? Is there any other mechanism we could get better insurance of getting $5, $10 per visit?
You got two things at play. First of all, that statute that was in your packet last week, it says that if an inmate's indigent, then the rules about the copay don't apply, that you still have to provide the medical to them. Second thing is an issue of collection. I mean, if you're paying $10 copay here or there, I don't know how many times an inmate may go to Cookeville Regional or something such as that, but, how much money are we willing to try to spend to get a judgment, to get that money back? And I don't even know if we can statutorily. But even so, even if we were to get a judgment, as an attorney, that a judgment can be hollow sometimes if you can't collect it. So I understand why you're asking what you're asking, and you're right, every little bit helps. But if they don't have it, you can't get blood from a turnip. I mean, that's just the
I
bottom
was
line.
just wondering if there's any best practice out there that we,
I'm not familiar with a situation where counties are going after inmates to collect judgments for co-pays on that.
yeah, I didn't mean a judgment, I'm just meant, like, there's
I don't know any other way to
anything
do
to
it other
attach
than
to.
to attach that money that's in the commissary.
Yeah,
That's about it.
okay.
As far as the vehicles and things like that that may be seized, a lot of times when those are sold, the statutes require that money be put in a drug fund or something such as that, so it can't be used for anything but that.
Okay.
So our hands are kinda tied on it.
Sure, thank you.
There is a way with the system the sheriff got put into place when he came into office. The commissary account stays active with the 85% recidivism rate out there. If they come back in, somebody puts $10 down and they owe us $5, we're gonna get it from them. So that debt stays there. It's not obviously being collected, but if they show back up again, there's a chance we will collect it.
All right, thank you for clarifying.
Commissioner Bennett.
Dr. Bates, we appreciate you
Yes,
being here.
thank you.
It's been good to get these questions answered by you. My question is, I know we have to provide health care to our inmates, but do we have to provide 24/7 health care, and if so, why?
Because it'll reduce your overall cost. Generally what happens is that the inmates know that the nurse leaves at, say, 10 o'clock or 12 o'clock. Well, at 12:01 is when they're gonna have their chest pain or their heart attack or whatever. So I urge every jail that's able to do this. Matter of fact, I don't know, Fayette County, Tennessee, we just got the contract there a couple of months ago. It's a small jail, it's not that big, I think 200 beds maybe. Trust me, they had sticker shock too, we were about twice as high, but they went to 24-hour coverage. It's just better because it prevents a lot of off-sites that would occur if you didn't have the nurse there.
Follow-up question to that.
Yes, sir.
Speaking of chest pain, I understand that you have EKG machines there.
We will, I'm not sure there's one there now, but we will have one there.
And then, do you have to do blood work with that as well to make an assessment as to whether they need to go to the ER?
Well, yes, and no. The thing is that we only use EKG if, for someone, let's say, that's 30 and having chest pain. Their propensity for them to have a heart attack is very low. So if you get a normal EKG, that makes it almost zero. 15% of people who have an MI will have a normal EKG, so it's not always, it's not the gold standard, and blood work is the gold standard there. But if you got somebody 30 years old and their signs and everything are atypical, it helps prevent it in that population. Not everybody, or if, say, somebody develops atrial fibrillation, you hear that on the news all the time about the drugs. You can pick that sort of thing up. There are a lot of good reasons to have an EKG machine in there.
Thank you.
Thank you.
Commissioner Williams.
Thank you. My first question is for the sheriff. You and I spoke earlier, and you talked about what kind of a deal we've been able to work out with the ER. Can you elaborate a little bit more on what kind of a discount we are getting from our local ER and how that is directly related to this contract?
Well, specifically, I told you a number. The ER and the hospital actually asked us not to reveal that number because it was so low, but it's very, very good. It's by far better than we've ever had, and I'm not sure they're giving anybody that percentage off, thanks to some of the people who are on the hospital board or who've been on the hospital board, as well as former Commissioner Bob Duncan, who helped us get that rate, but it's a tremendous amount.
No.
And the reason they were willing to give that amount is because of the coverage that we now are about to have with the RNs and
they're willing to do that because we now have RNs on staff all the time?
Correct.
Okay. My second question is for Mr. Hart. Jim Hart? Now, you work for CTAS, correct?
Yes, sir, I do.
And your job is basically everything to do with corrections or law enforcement in general?
Just jail, sir.
Just jails, okay. What have you seen around the state, or do you have a recommendation as far as should we contract outside with a third-party group such as this? Or should we hire our own and have our own? What are you seeing around the state, and do you have a recommendation about that?
The trend is privatization of healthcare, and I think that the doctor's done a great job of sort of laying out those reasons, what you get, the buying power that you get, the training, the administrative structure that you get in place. He's done really a good job. Now, have I seen counties that have hired their own doctor, hired a nurse or two? Yes. Small counties, small rural counties that just, bottom line, the dollar figure, trying to get by to just give some very minimal coverage. He alluded to, do we have to, is it a wise decision to provide 24/7 health coverage? I ran the Hamilton County Jail prior to my employment at CTAS, and about 21 years ago, the doctor and 2 nurses were healthcare employees, and that as a jail professional. He was exactly right. At 1400 is when our nurses left every day. At about 1430, our emergency room transports just went through the roof. We had a county hospital. We still had to pay those bills, even though it was a county hospital. There was a cap that was placed on the hospital each year that the county provided indigent fund to, and once that indigent fund was exceeded, we got the bills. But we basically, within my recollection was within probably the first 5 to 6 months, we had already fully exceeded the county's indigent money that was put in just for inmates going to the hospital after hours. We contracted, we pursued a contract and immediately recognized cost savings in emergency room transports and hospitalization and those type of things because of the round-the-clock coverage. But the trend is privatization for healthcare simply because of the challenges that we're faced with. And the doctors mentioned opioid. About 30% of our populations in jails and prisons across the country have been diagnosed with a serious and persistent mental illness. Those challenges that we're faced with, the high incidence of potential for suicide, again, those issues, meth, opioid crisis are all things that we just are having to deal with and try to stabilize as they're coming to those facilities.
Commissioner Atwood?
Wow. A lot of information, and I'd like to also thank you so much, gentlemen, all of you, for the time you put in to this endeavor. So it's very much appreciated. And Dr. Bates, thanks for being here. Appreciate your candor and also the specific answers you've given us. I've got a couple. Specifically, I guess the one I'd really want to know more than anything else is what are the fixed costs in the 1.01478 amount that the contract calls for? And then by fixed cost, I mean basically what are the people costing us? The other things are variables. We don't know how much medicine. We don't know how much of the other things that obviously are involved in you coming up with that number. So my question is, what are fixed amounts of that 1.14014? Am I clear on my question?
Let me try answering it, and then we'll see. If you're asking me what the fixed costs are in terms of the employees, the FTEs, the answer is I really can't give you that, and I'll give you an example. I think I talked about this earlier. We offered the HSA position to a nurse, and I'm not going to tell her exact salary, but she already had an offer on the table for $2 an hour more than what we offered her. So what we had anticipated for that salary ended up being higher than what we had planned for. On the other hand, another employee, and I don't want to mention who, but we actually got for $10,000 less than what we budgeted for. So it's very difficult to say because we have to compete with the hospitals here, the nursing homes here, and also because this is not the most favorable environment for a nurse. on evening shift and some other in other places, we've had to pay a differential for working night shift because there's just not enough applicants to draw them in. So you might have to pay a sign-on bonus to get a nurse. There are nurses all over and I think you'll agree with me, sign-on bonuses being paid all over the place to get nurses to come. So it's very difficult to say what that number will be. We will keep it as low as we possibly can, but we want qualified people, and we want people, because our contract is kind of the minimum of what you expect to pay. What you don't know is how much you're going to spend off-site. And the reason, and I don't want to belabor this point, but the reason why it's so important the sheriff's done what he's done, I did this back some time ago. If you had a CT scan in Sweetwater, Tennessee, it cost $3,500. If you went down the road to Cleveland, it was $1,700. If you had that same CT in Putnam, it was $700. Medicare reimburses $400. So even if you had a 50% discount at Sweetwater, you're still paying way more than you should be for the cost of that CT.
See, I get all that, and I appreciate your answer, but that's going to be our cost regardless of whether we do it ourselves or whether you do it. So the only thing we can compare, as I can see it, is labor. Can we do and hire labor ourselves for cheaper than what? Where did you come up with that $1 million? I mean, I know you didn't throw darts at a target and say, okay, our contract's going to be for $1 million. So how did you arrive at that number?
Based upon the nearly 30 other jails we've got in Tennessee, and for population centers similar to the size of Putnam. Plus, we were here before, and so that gave me a rough idea of what we had spent in the past, although that's been quite a few years ago. But we've got jails all around here. We've got White County, we've got Clay County, we have Smith County, we have several jails around here. So for the LPNs, that's a little bit easier. But when you get someplace like here where you have a hospital and you get some of these rural counties, you don't have the competition that you do in a place like Cookeville. So that makes a difference. And again, you got to remember, we got almost 1 million person nursing shortage out there, and when you're competing for nurses, you've got to be competitive. So you're going to pay exactly what it cost us to get the nurse.
And I get that. I really do. What I'm trying to do is arrive at how we can compare apples to apples to see what those costs would be. And we're fortunate. We got a nursing school here in Cookeville, so I mean we can draw from the graduates there as well. So I'm not doubting anything you're saying. I'm just looking for how we can compare those costs. I can't compare the variables. They're going to be the same whether you do it or whether we take it upon ourselves. So the only thing I think we as a body can compare and explain to our constituency is labor. You know, they're charging us so much for labor. We can hire these same people. So it may not be feasible. And certainly, Ms. Tart, I appreciate your response to that as well. I'm not saying that's the alternative, but I am saying that's something that I feel like we need to look at.
In answer to that, you would pay the same thing that we're paying. The one place that you couldn't compete with us on is the cost of the pharmacy or the med-mal cost. You just couldn't.
Okay. And the next question I have is the negotiated cost, Mike, this might be for you, is the negotiated cost of the Cookeville Regional a part of this contract? In other words, or is it separate?
Separate.
Okay.
Separate agreement. There's no cost associated with it to the county itself. It's a savings.
But the question I'm asking is they'll bill for their services. Will they bill them or
they'll bill directly to us.
Okay.
Just like this company and the other company negotiated discounted rates, they get 12%. There's companies out there that do that as hired guns.
Okay.
They'll negotiate, but they get 12% of whatever they save. CRMC, they're going to bill directly to us. They're not negotiating. We've taken care of that. We've taken, the big elephant out of the room. So these off-site travel folks that come in for the x-rays, whatever the case may be, that's different. But most of those bills, $100, $200, $300. We get a $5,000 bill, we'll negotiate with them and say, Doc, what do you think? And if he says, hey, you could probably get it cheaper, or we can work on it, go for it. It might be worth the 12%. But other than that, it's not. We've taken the big elephant out of the room.
What is the credential, if I could, Dr. Bates, for the mental health? What is this person, is it, I noticed there's several definitions as it relates that a counselor is acceptable, you know.
I will say that this person has a tremendous amount of experience and works at one of your mental health departments here in Tennessee right now. I don't recall, I can find out if she's an LCSW or an LCP. I'm not sure. She's one of those two. I would think she's an LCP or LPC.
But your only requirement to come to work for you in that regard would be experience?
No, they have to have a master's level degree.
Okay, that's what I'm asking.
Yeah.
Okay, Mr. Chair, I appreciate you so much, and I want to hear the rest of the debate, but I do have an amendment I'd like to make before we cease, if I could. But I want to hear everything else that's being said, please.
Okay. Commissioner Martin.
Get up close to your microphone.
Now, you know I'm getting old now.
Mr. Martin. Mr. Martin.
Okay, that's okay.
Mr. Martin, get up closer to your microphone, please, sir. We're recording. I can't hear you, buddy.
I told you I quit buying green bananas a long time ago.
Well, I kind of understand that. First question, is it unusual, or do you think it's unusual that we only received, for our county, that we only received 2 bids?
No. And I'll tell you why. It's because...
Yes, tell us why.
Sir?
Yes, tell us why.
There's not that many companies in this market, and they're getting to be fewer and fewer. Most of the companies, for instance, you have a couple in Nashville. They're merging with other companies, and they're not taking on jails of this size. So, I mean, we're making a decent amount of money off of you, but when you compare that to a 3,000-bed jail, it's not that profitable.
Thank you. I hate to hear that you're making a decent amount of money. I'd rather you say we're making just a little bit. But
well, when I say that, I've got all these people I got to pay. So.
Number two. You tell us, or you've told us that you have become an expert witness, and I understand that in the medical side. Could you give us an idea of the larger liability issues that you've been involved in the court system, where you did have to present as a medical expert? What kind of liability are we talking about?
Millions.
Millions.
I tell you, and you can look this up. Google Huntsville, Alabama, about 2 years ago. They had 3 deaths in that jail in a year's period of time. My malpractice premium, and we just had the same malpractice care, we weren't involved in the jail, jumped 40%. The company that we had went completely out of the business. So we have, this is one area, and I say this, and I don't mean this disrespectful, but healthcare is one place where you can try to save $1,000 and spend $100,000. It's not like, you know, how you got a McHenry tractor and a Ford tractor, we got the same PTO and all that kind of stuff, and you can save $5,000. It's not that way in healthcare. So it behooves us to do the right thing, and even when we do the right thing, somebody's going to bash us upside the head. So, but if we do the wrong thing, we know we're going to get it.
Thank you. Last question. We've discussed the issue of mental health. My question to you, and I hope you have somewhat of an answer for me, is this issue on the increase, mental health, are those issues on the increase nationwide, this part of the country, in Tennessee, what are
You're
we
trying to get
looking,
me to
what
say
are we
people
looking
in
at in the
Tennessee
future?
are crazier than Alabama, is that what you're trying to say?
Alabama, I understand that too.
No, the answer is yes, and here's the reason why. And the reason the costs are going up is because the inmates that started opiates 10 years ago are about half dead now. And so, and we've got the problem of hepatitis C come along. We still got HIV that's undiagnosed. We've got, and this is one thing I try to get commissions to understand, and I don't know why healthcare is so siloed, but if you look at it, the public health department is the jail. Because every communicable disease comes through that jail. Every STD, TB, everything you could want in the community. So it's really the catchment area for public health for your county. Because the people who have those disorders, and we're seeing a much sicker population than we did when I started this 13 years ago. And I started the company 13 years ago. What I didn't say, I've been doing this as a physician for probably 20, 25 years because I took care of an aged and infirm prison part-time when I was in practice. So it's a much sicker population now that we're seeing. There are a lot more deaths. The number one cause of death in a jail is suicide. And just to expound on your question, when I met with the med mal carrier about 3 or 4 weeks ago, I asked the person that does the litigation stuff to send me their bullet points of the top things they were seeing in terms of litigation. The first one was suicide. And it's suicide within 72 hours to get to the jail. Now, normally, if an inmate answers no to all the screening questions, the guidelines say you have 14 days to do that assessment. To me, that's too long. It really should be 48, 72 hours at most. So there's been a spike in the number of people who are committing suicide soon after getting to jail. The other thing, I think I mentioned this earlier, was the use of agency nurses in the jail, which in some places, you don't have any choice. There wouldn't be anybody there because there's just such a nursing shortage, you can't come up with those folks. Opiate withdrawal, that's the third thing that they listed as the thing they're seeing the most litigation with. And benzodiazepines or Valium, Xanax, that kind of drug. So there's a lot of problems. And people ODing in jail. We had a guy die in a jail who got a routine traffic stop but had just bought 3 grams of meth before he got pulled over, swallowed it all, and died within an hour of getting to the jail. Didn't tell anybody. Matter, he died anyway.
Doctor, appreciate your time.
Thank you.
As I know all the commissioners do, and thank you for coming. And do you have any questions of any of us?
Let me just make one comment about delaying the vote. I've heard that mentioned, and certainly you have the power to. As we've hired 2 new nurses, one of them starts Wednesday. I don't want them to get the feeling that this is a transitional thing. I was over at the jail before I came over here this afternoon, and the nurses were all in a buzz about this meeting tonight. So these people can go anywhere and get a job, and I don't want there to be any instability.
Thank you.
Thank you.
Commissioner Cassidy.
Dr. Bates, again, thank you for being here tonight. Appreciate your time, appreciate you and Mr. Hart being here to help us make a good decision for our county. Very simple question. Tell me exactly what $97,250 a month gets me, and tell me what you're going to bill me for over and above that.
I can't tell you what I'm going to bill you over and above that. We probably won't reach that number. I can't guarantee that. But as I told you earlier, you're just going to pay the expenses. For instance, for this month, there are no RN expenses. So you're not paying for the 4 RNs that we have in the contract right now. So I can't tell you, my hope is that will be less than that, but what you're getting is our experience, our ability to recruit, retain, and train and my 40 years of practicing medicine.
Okay. Mr. Jordan Wanson.
Thank you, Mr. Chair. Just a real quick question, like if, going back to what you had just mentioned there, hopefully we won't reach that number, the 97,000, but, should we not reach that, then where does the difference go? Just for the benefit of everybody, where does the difference in the money go? Does that come back to the general fund, or where does that money, which pool of money does that go to, so to speak?
It would come back to us as a credit, and against, future charges. Obviously, this is reoccurring. So that will come back to us, and just like anything else in this line item, if it's left over, it'd go back to general fund. At the end of the fiscal year, at the end of the contract, it doesn't make a difference. The problem we had before was cost pool, we never knew. And so when we went over, we started delving into cost pool. Last year, we were almost $170,000 over cost pool. So you're about $250,000 more than what the contract was. So it was very misleading. At least here we know. We'll be able to track it, and we'll turn it right back. We can't move it around. This money, if it's in here, it's in the jail side. We can't go out and buy, whatever, new parking meters, whatever we wanted to buy, we couldn't do it.
Makes sense. Thank you. Yes, I figured that's where it was going. I just want some clarification on that, just to make sure. I want to reiterate what everybody else said to Dr. and CTAS also. Thank you folks for being here and answering a lot of questions. It's been very helpful.
Are you ready for your amendment?
I am. If the discussion is over, I am.
I want to recognize Mr. Jones, right quick, to make sure we do understand the contract and what cost plus means. Mr. Jones, thank you.
Well, I think if you look at Article 3 of the contract, it pretty much lays out what it is that the county is going to pay. This is the article that's entitled Compensation and Adjustments. Section 3.1, and I'll try to make this very quick, Mr. Chairman. Section 3.1, the first sentence says that the county will reimburse QCHC for the direct cost of all services provided to inmate detainees at the jail under this agreement. And it goes on to list the direct costs that will be provided. And those are enumerated in Appendix B. It's also referenced as Exhibit B in the contract, okay? So the total charge for that is $1,014,782.61. That's the annual cost, plus $52,217.39. Now, that was an annual budget based on the average daily population of 400 inmates a day, okay? So that's broken down into 12 monthly payments, and this is Section 3.2 of the contract, of $97,250 each month, 1/12 of the budget. In Section 3.3, it speaks to a quarterly reconciliation. So each quarter is like a quarterly true-up. Each quarter, if the direct costs for everything, labor, medical equipment, laboratory, the $97,250 in that month, or for those 3-month time period, then there's a true-up and the county pays the excess. And just as Mike said, if it is less than the $97,250 per month per quarter, then there's a credit that's carried over to the next quarter, and that will be deducted from the direct cost if it exceeds the $97,250 per month.
Medication?
Okay? Everything, all the direct costs provided to the inmates. If you look at the first sentence of Section 3.1, everything is billed to the county. And the question is whether it will, in a quarter's time, exceed 3 monthly payments of $97,250 per month. So if it's in excess of that, then we're going to pay more. If it's less, we get a credit that's carried over to the next quarter.
Okay. Thanks, sir. So, Mr. Atwood, you're still up. I know you don't exist up there.
Sorry about that.
You were still, okay.
And I really appreciate all this debate. I really, really do. And certainly, my intention, Dr. Bates, is not to show instability to your personnel. I mean that sincerely. I'm not looking to do that, but I am also looking to do due diligence for the taxpayers of this county, and that's my interest, as well as providing the best health care that we can do. I hope you understand that. Having said that, I want to contend just a little bit with what Jeff said. The $1,014,000, whatever it is an estimate.
It's not a fixed number you know, they got the 97 by dividing that plus the 15%, but it is not, fixed. So, having said that, and I'll move to my amendment, I think it's at least for us as a commission to investigate the potential for what the cost would be, and I'm not proposing that it's better. I'm not saying that, but I think we need to at least look at it. I'm going to support this contract tonight. I think we need to engage in this contract, but I'm going to ask, and my amendment is, that that we ask our county mayor to investigate the cost to the county to employ the exact same personnel that they have proposed to put in the jail, and report that to us by the April meeting. That gives us 4 months to look at that cost. It also gives us time before the budget to understand that. And it doesn't mean we're going to adopt it. I'm not saying we adopt it, because we're fixing to adopt a one-year contract, and I'm going to vote for that. I'm just asking that for the taxpayer, we do our due diligence and ask our county mayor. Frank, I spent last week talking to the people in my medical park. I've got LPNs, and I've got RNs, and I've got physician's assistant nurse practitioners. I priced those salaries, and I used worst case scenario. I was surprised. So all I'm asking, and my amendment is, like I said, is that we ask the county mayor to look into that and report back to us by the April commission meeting. That's my motion, or my amendment.
I'll second that.
Okay, I have an amendment and a second. Any discussion on that amendment? I have a question. Contract ends January 21st?
Current 60 days.
Right. What happens from January 21st until April?
That's what you voted on for a one-year contract from
If
January 21st.
If this amendment passes, if this amendment to the motion passes as amended.
I'm not changing the motion. We're going to vote on a one-year contract.
Okay.
I'm just asking the mayor in the interim to report back us in April. That doesn't mean we're changing in April
I'll just
at all.
make sure
I'm
we
not
understand.
professing that. I'm just asking that we have numbers by then to look at.
So we can make a
and
decision
compare.
later at budget time. Okay. Any discussion?
My discussion's on the main motion.
Okay, we're going to have to come back to
Okay.
that.
All right. So we need,
Mr. Moss, you got it?
on this amendment, Commissioner Moss? Okay.
Well, it was actually before he made that amendment, but it's basically the same thing. Do we not have 60 days, one way or the other, whether they want to keep it or whether we want to turn them down? So we got 60 days. I don't know that we need to, well, his amendment's not gonna be voted on anyway, is it?
Yes.
It is gonna be?
Yes, the amendment will be considered, we have a motion and a second, so we will.
Okay,
vote
I
on
don't
that.
understand why we would need 4 months when we already got 2 months to turn it down if we don't want it, or we don't like it, or they don't like us.
His motion, that's why I wanted to make sure that everybody understands, his amendment, is to just have our county executive solicit cost if we do our own. So all he's gonna bring back to us in April's information.
Do we need to vote on that then?
Yes, because we have a motion and a second, we must vote.
I'm looking at it more from a timeline, Commissioner Moss, that we lock down that by April we'll have that information. That's just for our own benefit. Again, I'm not professing any change in this contract whatsoever. All I'm asking is information, to pursue information, so we'll know. I've heard tonight several people asking about us doing this ourselves. And you know, without having those numbers, there's no way we can know that. All I'm asking, let's supply those numbers. Let's have that in front of us to consider.
So this is
That's
just
what
an
my amendment is.
FYI then?
This is informational amendment, yes. And then we'll go back to the original motion that involves the contract.
Thank you, Mr. Chairman.
Chairman Rogers, can we ask County Mayor Porter if he has the manpower to perform this request within the scope of what they do? If you got somebody that's by April's gonna be able to plug in, I just wanted to hear what you're thinking about that.
I mean, I don't know where I'm gonna come up with the information at, other than talking to the folks at the hospital and talking to the folks here with with the jail contract, I mean, we can look at what the going rate is for nurses and all those kind of folks, but then you gotta look at county benefits and retirement and health insurance and all that kind of stuff. I mean, if you want me to do that, I mean, I'll be happy to do it, but I'm gonna have to work with the sheriff and these folks and the hospital and everybody else to try to come up with that number.
Okay. We are back to the amendment.
Get it close to the microphone, please.
If we get to this point on the review or study, whatever you want to call it, and the decision is made that we want to do this on our own, what's that gonna cost us? We've already signed the contract.
We have a 60-day out, so we would give them a 60-day notice. From what I understand the contract, Mr. Jones, correct me if I'm wrong, and we will let them know. Mr. Atwood's amendment is just to gather information so we have a cost to compare to the contract and make a decision. I'm assuming more like at budget time, somewhere in that area. We pass a budget normally in July.
I just set a timeline.
That's further than 60 days away, so.
I just set a timeline.
Yes,
I thought
sir.
by April, he would have enough time to contract. But I want to do my due diligence. That's all I'm asking for, is that let's find out.
Mr.
Let's
Jones?
don't suppose it's gonna cost this. Let's see if we can find out what that number is. What we do with it is then ours to decide. We
Yes, sir.
may not do anything.
Mr. Jones?
Yeah, I don't think that there's a penalty clause in the contract as far as termination goes. Termination is spoken of in Article 4 of the contract. If you look at Section 4.3, there's basically two ways to terminate the contract, one for cause and one without cause. And just as Chairman Rogers said, the termination without cause, it says, notwithstanding anything to the contrary, the county or QHC may, either party, may, without prejudice to the rights of the other party, terminate this agreement for convenience without cause by giving 60 days notice. So there's a 60-day out clause.
That's it, that's all it is.
That's it. Mm-hmm.
Just want to be sure.
Okay. We're going to do a voice vote because the amendment does not actually involve money. We will do roll call for the original motion, but the amendment does not involve money. Commissioner Donadio.
Sorry about that.
It's okay.
I guess my question is on this, since I was going to ask for the same type of thing, is get the information so that I can go back to my people and say, hey, look, this is why we're doing this. This is going to cost time and money to put together this packet that's going to let us know, does money need to be appropriated for that purpose or not? Okay, that was just my question on that. Does that need to be?
Okay. Thank you. So all in favor of the amendment, say aye.
Aye.
Any opposed?
No.
All right, let's do a roll call, please. So we have transparency.
All right. We're voting strictly on the amendment. Does everybody understand? Wait before you start voting, okay? Everybody understand we're voting strictly on the amendment, not on the original motion at all. All right, take your handsets. If you favor the amendment, vote yes. If you do not favor the motion, vote no. Everyone please vote, and please stop right there. All right, all your votes are in. Does anybody wish to change their vote anywhere? Please press confirm now, ladies and gentlemen. Everybody press confirm. All right, Mr. Chairman, yes, 9 no, 0 absent. Motion carries.
Thank you, Mr. Clerk. So we're back to the original motion, and we're still on 2A. So we will do I'm sorry, Commissioner Cassidy.
Mr. Jones, I know you looked over this contract very well, and you discussed briefly the quarterly reconciliation in 3.3.
Yeah.
Theoretically, if we had a credit every quarter, does the contract ever stipulate how we would settle up with that?
In other words, would we get money back in our pockets? I don't think it speaks to that.
So theoretically, if we had created even the first quarter and then broke even the next 3 quarters, that money sits out there in perpetuity. It doesn't ever come back to the county.
The contract's silent as to that.
Commissioner Williams.
Thank you, Mr. Chairman. I don't want to delay anything further, but I heard that there may be 1 or 2 individuals of the public who might have some special insider information, and I'd like to recognize them if possible.
Anybody that?
Ma'am, you need to come forward, come to the microphone. Please state your name, please, for the record. Thank you.
Can I give you a time limit? I'm sorry. I've
3
got
minutes.
3 minutes. Thank you.
My name's Gina Ralston, and I'm with Southern Health Partners. I just wondered if any of you all got to look at with our services as well. I was just wondering.
Who are you with, ma'am?
Southern Health Partners.
I will speak. What I have, and I missed last week's meeting, I was out of town, but what I have is the comparison of health care.
Okay.
Anybody else have anything to add to that? That's her question?
That's why I asked that question earlier.
Okay.
Okay. I just wondered if any of you got to review it. So if you haven't, then maybe you should. Thank you.
Thank you. Anyone else in the audience would like to speak? Okay. We will do a roll call on the motion as amended.
All right, ladies and gentlemen, take your handsets. If you favor the motion as amended, vote yes. If you do not favor that motion as amended, vote no. Everyone please vote, and please stop right there for me, please. All votes are in. Anyone wish to change their vote anywhere? Anywhere. Now, ladies and gentlemen, would you please press confirm for me, please? Everybody press confirm. Mr. Chairman, I have 23 voting yes, 1 no, 0 absent. The roll was called. Motion as amended does pass.
Commissioner Atwood.
All right. Most brisk discussion we've had in a long time. Very profitable for me. I don't know about you guys. Item B then will be budget. Fiscal Review Committee recommends approval of the budget amendment to the county general fund, and I so move.
Second. We have a motion second. Any discussion on item B? Mr. Clerk?
All right, seeing none, take your handsets. If you favor the motion, vote yes. If you do not favor the motion, vote no. Everyone please vote. Stop right there for me, please. All votes are in. Anyone wish to change their vote anywhere? Please press confirm for me now, ladies and gentlemen. Everybody press confirm. Whoops. Mr. Williams.
Trying to press it here.
Ah, there we go. Good job. Mr. Chairman, we have 24 voting yes, 0 no, 0 absent. When the roll is called, motion carries. Hang on just a second. All right. Thank you, Mr. Chairman.
All right. And item C is Fiscal Review recommends approval of the budget amendments to the general purpose school fund, and I so move.
We have a motion second. Any discussion?
All right. Seeing none, take your handsets. If you favor the motion, vote yes. If you do not favor the motion, vote no. Everyone, please vote. Stop right there for me, please. All votes are in. Anyone wish to change their vote anywhere? Please press confirm for me, ladies and gentlemen. You're doing great. Thank you so much. Mr. Chairman, we have 24 voting yes, 0 no, 0 absent. The roll is called. Motion carries.
And that concludes Fiscal Review, Mr. Chair.
Thank you, Mr. Chairman. Nominating committee. No business. Thank you, sir. Item B, report of special committees. Item C, resolutions.
There are no resolutions, Mr. Chairman.
Thank you, Mr. Clerk. Item D, election notaries.
William D. Birdwell, Ashley A. Browning, Timothy Cody, Holly Helton Jarvis, Kim Lyles, Jennifer J. Maddle, Gail Paul, India Pennington, Amanda S. Reynolds, Tony Jane Russell, Jamie L. Thornsberry, Christy Dawn Treese, Sam T. Warren, William Worrell, and Crystal L. Young.
Motion to approve?
Have a motion and a second. Any discussion on that? All in favor? We gotta do, I'm sorry, we gotta do the,
Got to vote on this one, yes.
Roll call.
Yes. Take your handsets, please. Got a roll call on this one. And if you favor the motion, vote yes. All right, go ahead and press confirm for me, ladies and gentlemen. We always do good on notaries, so thank you very much. All right. Mr. Ford. Excellent. Mr. Chairman, I have 24 voting yes, 0 no, 0 absent. When the roll is called, motion carries.
Item E, other new business, recognize cash flow analysis for the general purpose school fund. It's included. No action required. Number 9, announcement statements. Mr. Porter.
On a happier note, Mr. Chairman, we received the Cityscapes Legacy Award for 2018 for the renovations that we did to the courthouse over the last couple of years, and very proud of this, and I know you will be too, and we'll post it here in the courthouse. Thank the commission for approving the money that we were able to make all the renovations to, and new roof and stuff still coming this year, but I was happy to accept this on behalf of Putnam County, and I want to let you know about it.
Thank you, sir. Can I get a motion to adjourn, please? We are adjourned.